Welcome to the Smile Sisters podcast, powered by the LA Dental Clinic. In each episode of the Smile Sisters, host Dr. Ozzy and Dr. Arazu Nasiri show you how you can transform and maintain your smile. The sisters explain everything you need to know about your mouth and why keeping it healthy is key to your overall health.
Hello.
Hello.
So today we're going to talk about breastfeeding and jaw development.
Yes.
In infants and children, right? And how it affects basically your growth.
This leads to a lot of people having to have their wisdom teeth taken out and a lot of other issues later on in life, like sleep apnea, snoring. And it all starts with breastfeeding, which is really crazy when you think about it.
Right. So the effects of that, 18 years later or so in your life.
Or like 50, 60 years later.
If you don't get them out. Yeah, sure.
So breastfeeding is really, really important because that natural sucking motion actually helps to develop the muscles of the jaw, helps to shape the palate or the roof of the mouth.
Yes.
Because when an infant is breastfeeding, their tongue is pressed up against the roof of their mouth. Mm-hmm. And that actually helps to form that nice arc shape of the roof. And that's really important for your airway. So sometimes kids who are not breastfed tend to snore or tend to have a smaller jaw and narrower jaw. And that can really kind of constrict your whole back of your throat, your airway, can lead to other issues like snoring. And not only that, but kids who don't get enough sleep then have more learning issues. And this has been shown that when kids get more sleep, they learn better. And snoring is one of the issues in kids that can stop them from getting a good night's rest.
Yeah. So when you're breastfed as opposed to bottle fed, you develop those muscles that are required.
Because the milk just comes out. You don't have to put any effort into getting that milk to come out. Whereas breastfeeding, there actually has to be some muscle action for that milk to come out.
And you have to create a seal in order to suck. And that seal is when you put your tongue to the roof of your mouth. And that basically shapes your palate, right?
It does. It shapes your whole upper jaw, and then the lower jaw reacts to that. Because the lower jaw fits within that upper jaw. So the upper jaw is like a lid on a box, and the lower jaw is the box. So the bigger the upper jaw, the more the lower jaw can then expand too. So the two kind of go together.
So that's true. I mean, one of the major things we do when we do orthodontics, and we do a lot of orthodontics here, a lot of Invisalign in particular, is we're trying to expand the upper jaw in adults who have already reached their developmental stage. So that is so much harder and often not doable anymore, right?
Not anymore, because those bones, when we're infants, I mean, they're like Play-Doh bones. Mm-hmm. Like any small pressure can actually shape the whole jaw, the whole, upper jaw. And whereas when we're adults, it's already shaped. No matter how much pressure you put on it, you can't reshape it anymore.
Yeah, so we're just trying to expand the teeth within that bony structure that's there. Yeah. But if the bony structure isn't wide enough, you're sort of stuck in that position unless you do surgery, things like that. Sure.
Yes. So apart from breastfeeding, there's another thing that our culture is kind of losing, and that's to eat hard foods early on. Yes. So baby food is mostly mush. I don't even can't think of any baby food brands that are not just a mushy thing.
Right, yeah.
And that's another issue, that we need to be able to chew tough foods early on. And it's the same thing. It's to help develop those muscles, help develop that bone. It's like any other part of your body. If you don't use it, the bones and the muscles in that area won't develop. So imagine if you have a child who just never uses the right arm. Well, that arm isn't going to develop,
right?
Yes. So it's the same thing with your jaw. And because we've moved to such a very mushy and soft diet, it's as if we don't get, we don't eat hard foods, nuts, things that really require chewing action.
Yes.
We really don't introduce those until much later. in a
And if you
child's
think
life.
about some adults never eat food like that
Yeah,
either. When
even
you
adults,
eat
yeah.
only processed food generally. So over processed food starts as an infant, and then you continue to eat foods that are softer and
Yes.
mushy, never developing
Never
the muscles.
developing the muscles. And a lot of these tooth issues, like starting with wisdom teeth, there's no space in our jaws. Our jaws are becoming smaller and smaller and weaker, and we're losing even the room for the teeth that we're like, evolutionarily
Supposed to have.
we're supposed to have, but we don't even have space. And then later on in life, a huge issue is sleep apnea.
Yes.
And this can lead to like a host of issues with heart disease. Of course, like lack of sleep can create all kinds of like mental fog, and I think it's been connected to like so many different aspects of health. And that getting good sleep matters so much, not only for kids. I mean, for kids, some schools have even started to open later. And just from opening later and giving kids another hour of sleep, their scores went up. So
Right.
imagine how important it is to get that full night of sleep for brain development, for, everything that you're doing as a kid, as you're growing.
If you are on a very soft diet as an infant and bottle fed, you're more likely to not have your jaw develop
Yes.
as wide, so it doesn't expand as much because your tongue is not sealing that area.
Right.
And then that can create some sleep issues. Why does that create sleep apnea?
The whole idea with sleep apnea is that your tongue and everything falls back as you're sleeping. And if your palate and everything is not wide enough, now those airways become really, really constricted.
Sure.
And air is not able to go back and forth easily. So you constantly have to wake yourself up to get a breath. And this is more prevalent as we get older and maybe put on even a little bit more extra weight.
Sure.
And all that weight is like kind of pushing everything back. So having the palate open, the airway open, that's a huge thing for sleep, because when you're sleeping, you just want that air to be able to go back and forth freely and not be constricted. And that is, sleep apnea, snoring, all these things create constriction in the airway. That's why you hear, snoring, because the air is not able to pass.
Right.
So now you're like having that noise, which is snoring. And that means that just the air is not open, freely passing back and forth. And those micro little waking ups can create a poor night's sleep, which can lead to all these other issues.
So for kids, their ability to learn,
Yes, yes.
and function in school, if they have sleep apnea, because that might have been started from a narrow jaw.
Yeah.
From an infant age.
Yeah. In kids, we don't normally call it sleep apnea, but a lot of kids do snore. And that's a sign that, air is not going back and forth.
Sure.
Freely. So, that's important. And, your child cannot get a full night's rest. Now they can't learn. And, it just goes on in their lives. Like if they're doing poorly in school, they're going to, maybe like not get the attention that they need. And then, maybe like not get into college. Like so many things can come just from like not getting a good night's sleep.
Right. So it's a snowball effect.
It's a snowball effect.
And also then their teeth can be crowded.
Yes.
So usually baby teeth, when they come in, they're spaced out, right?
Yes.
More spaced out.
Yes.
Which leaves room for the adult teeth. But if your jaw is not developed enough, those baby teeth can be more crowded, which means then as your adult teeth come in, you don't have enough room for them.
Yeah, so let's talk about that for a second.
Sure.
So baby teeth are narrower than adult teeth. So when you see a child, they should have spaces in between their baby teeth. That's what we want to see. We want to see some spaces in between. We don't want to see all the teeth lined up perfectly. And then when the adult teeth come in, now they will be occupying those gaps,
Right.
and lining up perfectly.
Right.
Nowadays, again, same thing, because the palate is not forming properly. The jaw itself is not wide enough to accommodate all these teeth. So we're starting to see a lot of crowding.
Yes.
Of course, wisdom teeth have no space to come in, so we ended up taking those out. And then all these other issues that we talked about, like poor sleep, sleep apnea later in life, can all come from just not having those structures developed properly when we were infants. And breastfeeding is a huge, huge part of developing your jaw and your mouth, the roof of your mouth, getting that seal. So when you swallow, your tongue should completely fill the roof of your mouth, and the shape of the tongue and the roof of the mouth are complementary. So for an infant, as they're sucking, they're actually shaping their own jaw.
Yes.
Yeah. And if they don't do that sucking motion, that jaw is just going to be very tiny.
Yeah.
So
Yeah, and doesn't develop
it doesn't
correctly.
develop.
Right.
Yeah.
So many things affected from
So
an
many
early
things.
age. So, but let's say that you have a child now and you see that their baby teeth have come in and they're not spaced out, and maybe their lower jaw or upper jaw is narrower than their lower jaw. What can you do, and what should you do as a parent?
Well, I mean, nowadays, if your child is still young enough, the bones are still malleable, and you can do expansion. Now, this requires orthodontic intervention now. So you can do things to expand the jaw and to still create that shape and that form. Past a certain age, I want to say around 16 or 17, the jaw is done growing. Like it's fused, everything is done. Now you have to actually do surgery and cut it and then move the two pieces away. And that's something you can do as well.
So that's why we do some phase 1 orthodontics, which
Yes.
is we do expansion type of braces
Yes.
on young children, usually when they are, before puberty.
Yes.
So, anywhere from 6 to 8, 9, this can be done. We're really just checking to see, is there enough expansion? That's
all
one
we
of the
care
main
about.
things.
So orthodontics can be in phased out too. So in the first phase, really the point is to create that space.
Right.
By expanding. The bones are still malleable. We can still kind of like push everything out and create that space.
We want to
that
get
we need.
in, expand the jaw, and get out.
And get
basically,
out,
when they're still young, and we have a good opportunity to do that. And
Yeah.
usually, then that makes the future orthodontics less complicated, if at all necessary.
Yes, that's true. Yeah, later on you may not even need it if you have enough space and things have a chance to come in. You may not even need a second round, but normally you do. I want to say most times you still do.
True.
We still can't compensate for that lack of development like early on. So we're still trying to move the teeth around to put them in the right position.
But it can make future orthodontics much easier.
easier.
The teeth come in well, they don't get stuck. So often other issues with a narrow jaw is some people, their canines get stuck and never erupt.
Right.
Correct?
Yeah, one of the teeth that usually gets stuck is the canines, like the upper kind of vampire teeth.
If you don't have enough expansion, one of the issues that happens as your permanent teeth are coming in is that your canines or upper eye teeth or vampire teeth get stuck.
They get stuck in your jaw, and then a lot of times you have to put a chain to like pull it down, expand, pull. So, so I mean, I guess just going back to what we want to talk about is the development of the jaw and the muscles starts right away with breastfeeding. And then the second thing is hard foods. We don't introduce hard foods early on anymore. And that can also has damaged the development and growth of our jaws and our muscles.
Sure. So you don't get enough development of the muscles, so your jaw doesn't grow as much.
Yes.
And then it leads to all these issues with sleep disruptions, snoring, your teeth not coming in properly.
Right. I mean, the teeth is really the least of it. Really, the development of the jaw leads to breathing issues, sleeping issues, and those can have really lifelong impact.
Sure.
And so it's really important to make sure that we have good open airway, that we're able to pass air back and forth freely while we're awake and, of course, while we're sleeping. And starting at a very, very young age, that if you don't get enough sleep, you don't do well in school, then you're labeled as someone who is not a good student, and then you see yourself that way and going on and on into later on in life. You're always a little bit behind.
That's true.
Yeah.
One of the clues that this might be going on can be looking at your teeth and seeing
Yes.
that they're crowded.
Yes.
And that can sometimes give us a clue that there might
a
be these
clue.
other issues.
And snoring in young kids. I mean, if your child is snoring, that means their airway isn't open. So,
Right.
you know, that's a clue.
Yeah.
And these are all little clues that you can see that my teeth aren't fitting right. I have overlapping teeth. My baby's teeth aren't spaced out in primary teeth. My child is snoring. All these things can show that the jaw hasn't developed properly.
Right. So early intervention with some orthodontics can actually be helpful
For sure.
with that.
Yeah.
And also from an aesthetic standpoint, I mean, there have been studies that show that kids that have straight teeth
Yes.
in their developmental age are treated better, even by their peers and their teachers, right?
Yes.
Because they have a nicer smile, so they tend to smile more, they tend to look up more and talk more and answer more questions, and that leads them to believe that they're smarter, that they're better than their
More
peers.
liked, yes.
So all of this has to do with this early development of the teeth.
It's true.
So
It's amazing how much, kids who break a tooth and then they're missing a tooth young, how much it affects your self-esteem growing up. Because if you're labeled as the kid who has a broken tooth or who has one tooth that's discolored or something, it can really affect so many things in your life going forward.
right. How you view yourself.
How you view yourself, how others view you, which then, reflects on how you view yourself.
Right.
And middle school is hard enough, man.
Yes. But it's interesting. There's a lot of psychology behind it. And often parents will be like, it's just the baby teeth.
Yeah.
Whatever, we can let it go. But it has all these consequences that lead to how your child sees themselves and how they grow up and who
Yes.
they become, really.
Yes, for
So,
sure. For sure, those
it's important.
formative years.
Yeah. To summarize from today's episode,
Yes.
what are the 3 things that we can do as a parent to avoid some of these issues?
So breastfeed if you can. That's really important. Introduce solid foods earlier if you can. Of course, speak to your pediatrician. We're not pediatricians, we're dentists. And finally, if you do see some of these issues, early intervention by expanding the jaw early on can be very helpful.
So you can book a consultation with an orthodontist or call us, and we'll be able to help you with that as well.
LAdentalclinic.com. Okay, that's it for today.
Yeah.
Okay, see you next time.
Bye.
Thank you for listening to the Smile Sisters. If you found this episode helpful, subscribe and leave us a review. To book a free consultation, go to ladentalclinic.com.